What this experience has been like for me for the past year?
My name is Christine Boos, and I am the epidemiology coordinator.
Sarah Baldoff, I'm the environmental health director.
Carla Walls, and I am a registered nurse, a community health nurse.
Brendan Bedard. I'm the Director of Community Health Services and Deputy Public Health Director for Genesee and Orleans County Health Department.
Sarah Catherine McLaughlin, and I am an Early Intervention Service Coordinator.
David Bell, I'm the Emergency Preparedness Coordinator for both Genesee and Orleans County Health Departments.
Paul Pettit, Public Health Director, Genesee and Orleans County.
Our first case came on March 17th, as many people know, and everything kicked into high gear. We had for months been hearing about COVID, but not to the magnitude once it, is obviously in our county.
So I actually started the day everything kind of shut down. So I've been here just over a year. So I was hired for that position, but kind of immediately went right into COVID response with everything, and still learning my job at the same time. I've done things I probably, if it wasn't a pandemic, would never have been exposed to.
It has been almost 24/7 in the beginning, and with the second wave, it was a lot of extremely long days working through the case investigations and then the contact tracing, coordinating with all of the people on our team to see who the relationships were, identifying where there's a cluster.
Our testing clinics, our vaccine clinics, our majority of our staffing is complete volunteer. We have other county employees helping out, and getting to kind of work as a team to collaborate like that is a really cool and unique experience that I'm really grateful for.
From the public health side of things, it's really been interesting. We've spent decades now planning for emergency response. How are we actually going to do mass vaccination clinics, points of dispensing? We exercise every year, but having the charge put upon us to actually go forward and do this for our residents for over the past year has really been a remarkable experience.
We have, especially in a rural setting, as Genesee and Orleans County are, we have a phenomenal staff, passionate people. We do great things besides the pandemic response. We are nationally recognized in various different things. So we look ahead a lot of times, always pursuing other avenues to increase the public health well-being in our two counties. So, and that's to be said on the various different accolades we've received and throughout the years.
It's been very rewarding, really. The people who come to our clinics, like our testing clinics, and then afterwards I've been working the vaccination clinics, which I love. People are so thankful that we're there for them. And so yeah, that's been really nice because it really gives you a purpose in life.
Yeah, there's definitely no way to overstate how good it does feel to help a community at a time where it's really valued and needed. I think that is a really unique part of the situation, is that we're giving a lot, we're working hard, but people really show that they appreciate that, and we know that it makes a difference, and that feels fantastic.
We're in the community. We know these folks, right? We live in this community. So they're our neighbors, they're our friends. We care about them. So ultimately the staff have a deep sense of caring, a deep sense of giving back to their community in their day-to-day job. They're giving of their time, they're working hard, they're going above and beyond to make sure that our community's safe. I'm very proud of the work that they've done. It's really been, again, just a very collaborative effort of everyone, working together, looking at the common goal and ultimately working for the common good of our community.